Welcome to Module 1, Fundamentals of Dental Implant. We will start this module with the introduction of dental implants, history, biology, and technology. At the end of this chapter, you will be able to define dental implants, understand the history of dental implants, differentiate between clinical and histological characteristics of tooth and implants, and outline the indications and contraindications of dental implants. In general, implant is a verb which means to insert or fix tissue or an artificial object in a person's body, especially by surgery. It also has synonyms of insert, embed, bury, lodge, place, and graft. In dentistry, a dental implant is also known as a endoosseous implant or fixture. It is a surgical component that interfaces with the bone of the jaw or skull to support a dental processes such as a crown, bridge, denture, facial processes, or to act as an orthodontic anchor. The history of dental implants started as early as 2000 BC, when ancient Egyptians used shells and ivory to replace missing teeth. In 1951, Peri-implant discovered that titanium has the ability to fuse to bone. And in 1965, the first ever titanium roots were implanted in a patient. There is no doubt that the science of dental implantology has evolved over centuries to produce the most successful and predictable tooth replacement technology ever. Now, let us learn more about the anatomy of dental implants. The soft tissue that surrounds the dental implant is called peri-implant mucosa. Following implant placement, a transmucosal passage is formed around the abutment. At clinically healthy sites, the keratinized oral epithelium is continuous with the junctional epithelium facing the abutment surface. The peri-implant mucosa provides a biological seal around the implants against the oral cavity. Early studies in dental implant anatomy started off with an experiment by Berglundh and colleagues in 1991. In this study, 5 beagle dogs were used. The right mandibular premolar region was selected in each dog for placement of titanium implants, while the left mandibular premolar region served as control. Extractions of the mandibular premolars were performed, healing allowed, following which titanium fixtures were installed in the edentulous premolar region. Abutment connection was carried out 3 months later. After another 2 months of healing, plaque control was initiated and maintained for 8 weeks. At the end of the plaque control period, clinical examinations were performed and biopsies harvested from the implant site and the contralateral premolar region. The results from the analysis demonstrated that the peri-implant mucosa which formed at titanium implants following the abutment connection had many features in common with gingival tissues surrounding teeth. In terms of the similarities between tooth and implant anatomy, both the marginal gingiva of the teeth and the peri-implant mucosa are lined by keratinized oral epithelium. They both have junctional epithelium measuring 2 mm, and the height of the supracrestal connective tissue facing the tooth is approximately 1 mm and approximately 2 mm facing the implants. These are some differences in their anatomy. The collagen fiber bundles found in teeth are fan-shaped, but in implants they are parallel to the peri-implant mucosa. Also, the connective tissue around implants possess more collagen but fewer fibroblasts. Thirdly, cementum is naturally present in teeth but are not present in implants. Last but not least, the blood supply for teeth originates from the supraperiosteal blood vessels and the vascular plexus of the periodontal ligament. In contrast, the implants are supplied only from the supraperiosteal blood vessels. Here is a diagram showing more on the anatomy of the tooth and implants. Here is an illustration showing the orientation of collagen fiber bundles. This diagram shows the comparison of periodontium interface with a natural tooth versus a dental implant. Patients often present with the desire to replace missing teeth or are faced with the need to have teeth extracted for various reasons. Here are some situations where dental implants are strongly indicated. Implants are indicated for patients who cannot tolerate a removable restoration or a removable denture. They are also indicated for patients with high aesthetic and/or functional demands. When a single tooth is missing, an implant-supported crown will preserve the adjacent natural teeth by avoiding the need to prepare them. If the toothless gap is restored with the traditional dental bridge, both adjacent teeth will have to be prepared. In cases where partial edentalism with the posterior teeth missing, such as in Kennedy Class 1 or Class 2, traditional dental bridges are difficult to design because the back support tooth is missing. Removable partial dentures generally require the preparation of more teeth. In cases where the bridge work is problematic or in the presence of periodontal disease or unrestorable teeth, dental implants are also strongly indicated. Are there any contraindications to implant treatment? To answer this question, a comprehensive patient assessment is required. It should be noted that most contraindications are relative. Absolute contraindications are present in several serious general conditions that can render anesthesia, surgical procedures, and the overall placement of implants inadvisable. These conditions include heart diseases affecting the valves, recent infarcts, severe cardiac insufficiency, and cardiomyopathy. Certain bone diseases such as osteomalacia, Paget's disease, and brittle bone syndrome. Certain immunological diseases, immunosuppressant treatments, clinical aids, or patients awaiting an organ transplant. Patients with strongly irradiated jawbones, or those undergoing treatments of osteoporosis or some cancers by bisphosphonates, or those with certain mental diseases. Relative contraindications are situations that are evaluated on a case-by-case basis. Most often, dental implants can only be placed after some preliminary treatments. Examples of these conditions include diabetes, angina pectoris, significant consumption of tobacco, certain autoimmune diseases, drug and alcohol dependency, and pregnancy. Local contraindications are conditions or physiological changes that temporarily prevent the placement of dental implants. Usually, these occur inside the mouth cavity and most of the time can be remedied before the implants are inserted in the jawbone. An implant is contraindicated when the alveolar bone where the implants should be positioned shows chronic infections, has an inadequate structure, or an insufficient height or width. To ensure a good prognosis, a dental implant must be surrounded by healthy bone tissue. Important anatomical structures, such as the maxillary sinus and the inferior alveolar nerve, may have an abnormal position that can interfere with the dental implants. Adjunctive surgical procedures have to be performed before the placement of dental implants to increase the amount of bone so that more bone is available to support the implants. Other local contraindications include hypersensitivity to implant material, poor oral hygiene, and bruxism. These are our references. Thank you for listening and have a nice day.